we are going to be working on some moves to really help strengthen and eliminate low back pain. Uh, this is perfect for anybody who's suffering from compression of the vertebrae, anything that's going on with the back that does not involve sciatic issues, okay? Anything to do with the low back, mid back, hips, but no sciatic. You are going to need a full length, that means it's a 36-inch half foam roller, okay? So we are gonna work both sides just to make sure that we get everything even. Although, whatever side that you're affected on, go to the opposite side. So let's say that you have low back pain that radiates more on the left, you're gonna go on the right-hand side to begin, and vice versa, okay? So we're gonna go right now, the left lower back pain. We're gonna get our foam roller, and we're gonna place it in the middle of the hip bone, and just start to slide over it. And we wanna get a nice elongation. Now, you wanna slide nice and slowly. It's not going to be comfortable, okay? So you want the hip up to the ceiling, the top leg to be locked, and you're literally just gonna slide down. Now, when you start feeling discomfort, stop and just hold that position. Your goal is to slide all the way straight down. And we're just gonna hold that for 3, 2, 1, and slide back up. Now, we're gonna place the foam roller right directly behind the hip, and we're gonna go on our elbow. Now, we wanna make sure that everything is done evenly. So it's important to give attention of the pressure points on your glute. If you start leaning, you're down too far. If it starts to spasm a little bit, give it a second to catch up. And while we're going back, we are now pushing our low back into the foam roller. So we are going to attempt to lay down over the foam roller. And it's very important that we keep our butt cheeks on the floor. Feels pretty darn good, actually. And we're just gonna hold this for a couple seconds. Now, using your core, if you're able to, I want you to sit up because that's where we're going next. If you're not, help yourself up by grabbing onto the foam roller or walking yourself up. Now, if we lift up, we should be in the right position. And we're just gonna go a little half crunch. Do not lead with the chin. We're pulling with the chest. If this is too challenging for you right now, skip it and add it in as you get stronger. 5. Now, we're gonna take the foam roller now, and we're gonna place the arches of our feet on top. We wanna make sure that we have a little bit of an arch in the lower back. Do not force your lower back flat on the floor. Never do that. We should have a natural curve in our lumbar area. We want to be straight up to the ceiling with our eyes. Do not tuck your chin. So the back of the skull needs to be on the floor. And this needs to be done on the floor, not a mushy surface like your butt. Now, this is important. We want to push down on the top of the foam roller with our arches and lift straight up. As you come up, it's important to keep everything engaged. Our goal is to come up as high as we can, clench the butt cheeks, and lower back down. If your foam roller is pushing away from you, that means you are pushing away with your feet. Don't do that. We want to push straight down. We're going to come up again. Also, you may get a nice stretch on the thigh. So if that is stopping your range of motion, you got to work on flexibility of the quad first. And we're going to come down and tap. Come up slowly. We want to make sure we have even pressure. We don't want to have any swaying. It's very important. And down, tap, come back up. Tap. We have one more. Awesome. Now, to get up safely, bring your knees into your chest, clasp your hands behind the legs, use your legs as momentum, and roll up. All right, now this is your first phase for eliminating back pain, hip pain without sciatica, building strength and endurance at the same time, as well as postural correction. All right, our goal is to do this every single day at least once. If time permits and your back allows, you want to do in the morning before you start your day, in the afternoon when you're chilling out, and then before bed. All right? So I would say about a good 6 weeks, daily at least one time. I will catch you on phase 2 in 6 weeks.